Whenever you create your customer, you're going to click this orange bar that's up at the top left that says Create New Customer, and you will put the information in for your client. Okay. From here, you will do the Create Customer and Quote. And what that's going to do is all of the information that you previously put in for that client will then go over into the quoting platform for the product selection. You would change your create or your coverage begin date, depending on what the effective date your client is asking for. The zip code, county, state, and date of birth, all of that's going to filter over into the quoting process as I've already created my client. So that's going to flow over into this quoting process. If at any point during this that you realize maybe you have the zip code incorrect or the date of birth incorrect, you would then need to begin again and start over because you can't change it from this point once you have started. Once you have entered in the data for this particular client, you're going to select the Get Plans tab. And then that will pull up all the product offerings that the client has available for them based off of the zip code and county state selection that you have. You'll have your HMO products for MAPD, if there's PPO. Those will be listed. You'll have your MedSup and then also Part D. So based off of the product that you want to select, you would select that product from this screen. You also have access to look at the benefit summary and any plan documentations that correspond to the product, so you can actually access them from here. So I'm going to select one of the products and just hit the Apply button. And if there are any additional benefits that you can add to the product, that pop-up box will come up first. And if there's not a product selection that I want to add, I will then just select Agent. Now, logged in as an agency at this point, so an agent would not have to select through multiple lists of agents, but they would have to select the parent agency that they are associated to. And this is all based off what is loaded in the Anthem licensing and credentialing system. Then you would select a writing agent. And at this point, like I said, from an agent logging in to use this tool, they would only have their own name there to be able to select. But they'll have to select their parent and the paid agency if they have multiple relationships. From here, you have one of two options. You either can create an electronic application or submit a paper application. But for the purpose of today, since this is going to be a call center environment, we're going to create an electronic application. And then what will happen is the information that you've previously entered into the platform will then transfer over into the application process. So again, at any point, any of the information that you've previously input in, you cannot change that information with the exception of the phone number, because the phone number doesn't actually impact the product offering that's available. And in some cases, maybe even the rate, like if it's a MedSup plan. So if you have noticed that any of the information is incorrect, you would actually have to go back to the beginning and start over. And I'll actually show you how to do that after I go through the application here. So the application that I have selected, of course, for this is an MAPD. So I've got my Medi Blue Plus, and you'll notice that it has my requested effective date. If there's any premium associated to it, you'll see all of that above. So from here, you will then begin to create or collect the information for the client. So you would collect their address. You'll notice again the county and the state pre-populated with the zip code. And then you would put in the city. If they have a separate mailing address or a different mailing address, you would put that here. And then you would put in the MBI number. So you'll have to put in your MBI number here. And then you'll put in your Part A and your Part B effective date. And those will default to the first of the month. I am in production, so if I put an MBI number, it's going to tell me it's not valid. But what I'm going to do is I'm going to try to go to the next page. If there are any errors or any missing information on the app capture screen, it will give you an error that tells you, would you like to correct these errors now, or would you like to move on to the next page? If you click the Fix Errors, it will show you highlighted in red what needs to be corrected. And you'll enter that information in and then progress to the next page. And I'm going to go ahead and progress. Okay. And this follows the flow of the application. So you'll see now I'm going to enter in my billing preference, so I can select monthly bill. If I select an automatic bank draft, it will then ask me for the additional information that's required for setting up the bank draft. or I can do an automatic deduction from Social Security. So you would just complete the steps based off of the billing preference that the client selects. And then it's going to just, again, follow the flow of the application, and it'll ask you the questions that follow along in the app flow. If there are any questions that you answer yes that then require additional information, like I'll answer yes here to the resident of long-term care, it's going to ask you additional information that would be required for that question that you've answered yes to. So you then would be filling in that information as well as you're going along with the flow. Okay. For your primary care physician, for HMO plans, if a PCP is not provided, what we'll do is we will auto-assign that provider to that client. But you do have the capability to go here and drill down into this blue link. If you're looking for a specific doctor, you can put in the doctor's name here, or if you want to do by city, state, or zip, you can search. And let's say you select one of the providers. I'm going to go down and see if I can select the provider. Once I click on this doctor, this is the doctor that we want to select. If I hit add and close, all of the information will pre-populate over into the PCP selection, so you do not have to key that information in if you utilize the link here. But let's say maybe you don't have a lot of information. You still can put information here, but if it's not enough to actually make the match in our system, they may get auto-reassigned to a different provider. So we strongly suggest you utilize this link if assisting the client with a PCP selection. And then you'll again follow the flow of the application. It'll ask you if you would like your document sent to you in a different language, or if you need any assistance for visually impaired, you have that option here. I will then go to the next page. And you'll see, since I had left this off here, it asked me to answer this question. So I'm going to hit yes, I've recently seen this physician. Okay. And then you have your eligibility attestation. So their eligibility reason you would be able to select here. So if I'm new to Medicare, I will select that, or whatever eligibility reason that they're eligible for, you will be able to select that. The one for AEP is only selectable during AEP, so you'll only see that during that period of time. So you'll see for annual enrollment, it only will be there during that period of time. Then you have email preferences. If you would like to get your information sent through email, you can hit yes or no. And since I had already put in that information above, it's going to pre-populate it. If not, it'll give me an opportunity to put that there. And then if I hit no, then it doesn't require it. Authorization, if you have someone that is an authorized representative to act on your behalf, you can enter that information here. Okay. And then from here, the agent information will be pre-populated based off of the selection at the beginning once you logged into the system. So all of that information will be pre-populated, so none of that will have to be entered in, or you cannot change it as well. So then you would answer this question, was this a face-to-face appointment? It would be no. This is where the legal agreement is from here. So this is where all of the legal agreements and disclaimers would then need to be shared with the applicant. And the applicant's signature here, it would be a voice signature because your call recording will be on file. The applicant does have to state their name, the date of the call, and that they are in agreement to the legal disclaimers that have been previously shared with them. And then you'll put that applicant voice signature here, and I will share that at the end of the demo. Then you will have to answer yes, I have read and agreed with the terms listed above. These are the terms. I agree to provide an original copy of the application if requested, yes. You'll notice that this next button is pre-populated to yes. This is the Zen Producer. This is an agent-facing tool. The agent did assist the applicant with the application. That will default automatically to yes. And then the agent's signature is where the agent would put their signature here. So whatever the agent's name is, you would put here. And I'll just put my name here. And you would just type it again. And the city and state and the date of the signature. You can select the date of the signature, which would be today. And then you would hit submit. I'm going to show you because I know I left some things off. I'm in production. You typically wouldn't submit in production with a test app, but I do want to show you since I do have things that are missing. It will give me a pop-up box that tells me that there is additional information that has to be included or input into the system before I can submit the application. So all of those errors would have to be corrected prior to the submission of the application. Once the application is submitted, you do get a pop-up box that gives you the application control number. It gives you the requested effective date, the product that you have submitted that enrollment for, and then this application would then display on your producer toolbox dashboard or your in-producer dashboard, wherever you're logging in from. For the voice signature for the applicant, some use different tracking numbers, so based off whatever your tracking number is, you can put that in as the signature. Some of our partners put on file and then put the confirmation number, or they'll put the client name and confirmation number. So whatever mechanism would be easiest for you to locate that application, that is our recommendation for what you would put for the client signature. So at that point, are there any questions over the application capture process?